Did y'all get something said? Yep, we are live. Hey, everybody. All right. Happy Friday, October the 13th. So I'm excited to be here today. I'm feeling good. It's fall. I love fall. It's October. This is one of those weekends. They said it's gonna be dreary this weekend, but this weekend is
Mm-hmm.
historically in Atlanta sunny. Because I have this on my calendar. Like if I ever got married, I was gonna get married on this weekend because historically it's usually a beautiful, beautiful weekend. And so it's raining this weekend. So we'll see. All right. So today we're going to talk about a combination of three things that kind of go together. So we're going to talk about anxiety and sex, anxiety medications and sex, and then kind of medication side effects and sex, and kind of
Mm-hmm.
put it all together. And so, oh, so first of all, let me say some basic things. Um, Premature ejaculation, a lot of times is just anxiety. You know, I'm scared. Some erectile dysfunction is anxiety. And so much of anxiety plays into male sexuality, and we call it all of these things, and a lot of times it boils down to anxiety. Also with females, because we don't label it anxiety as much with females, but vaginismus is at its core anxiety. You know, um, let's see, what else with females? Sometimes, not all the times, low sexual desire is anxiety. Um, and that would come out in the form of I'm scared that this person sees my body, they'll run out of the room away from me. I'm scared that I'm not a good partner or I'm not a good lover, like I'm not going to be able to be a good lover. And so I'm going to just kind of be scared of that and stay away from because I have so much anxiety that I'm not going to do a good job that I don't want to do the job at all. So sometimes low sexual desire is anxiety. And so anxiety has a way of really kind of um I feel like hiding out in the sex room, hiding out in the sexual arena, and we don't. And sometimes, like if you come into therapy, definitely we're going to identify it. But I think in the general public, we don't identify it as often. Of like, yeah, that's just anxiety. If you are a person and you're prone to, ooh, I'm excited to have all y'all here. If you are a person and you're prone to anxiety in general, it's probably showing up in your sex life some type of way as well. Okay. All right. So I'm going to give everybody kind of a chance to talk about what you've noticed with clients and anxiety and sex, or clients and anxiety medications and depression medications and mental health meds in general, how they affect people sexually, and any other kind of sexual medication side effects. All right. So good morning, Sharian. How are
Good
you?
morning, everybody.
We're
Morning.
Good
talking about
morning.
we're talking about sex and anxiety. So I'm going to let everybody kind of weigh in with their opinions and how they help clients through this process. And then Sharon, you can jump in and on the tail end and bring us home. All right. So we're going to start with Jessica Addison. So Jessica, oh, where do you start with a client who has anxiety or is presenting
Mm.
with one of these things, or even their own mental health meds, and they're not sexual? What do you do?
First, I will ask them, are they on any type of medication? Because I have a lot of
Mhm,
clients who are. I
mhm.
always tell them to talk to their physician because, of course, we're not doctors. We can't really prescribe or anything.
Right.
I ask them if they are currently on medication. What are the side effects that you were told? And a lot of times they give me a laundry list of side effects. And then they said, but I don't know if I have all these things, but then when they're talking to me, everything that they're saying, issues that they're having, checks everything off the list. And I
Mm,
tell clients that sometimes when physicians or doctors go to medical school, they don't teach them about how it's going to affect your client sexually in the midst of intimacy, connecting,
mhm,
and all that jazz. So I would say kind of go back to your physician and bring up, hey, I'm having some concerns in my sex life. I know I'm on this medication, but can you further let me know how is this going to affect me sexually? And once you kind of get a gist of what it does, start doing some things around it. Maybe some relaxation exercises. Maybe it's some scheduling. Maybe we
Mhm.
have a low sex drive. What things can we do to that? How can we be more connected and intimate with each other? And go from there of what you're comfortable with. So you
Mhm.
won't let this anxiety be the end all be all sentence to where you feel like you have no hope for the future. So seeing what we're
Yeah.
up against and seeing how we can work around that.
Excellent. I love it. Okay. All right. All right. Mary Hannah, I'm going to let you go next, and then I'll go to Taj, and
Yeah.
then I'll go to Sherry. All right. What do you think, Mary Hannah?
Yes, well, definitely see this topic so much with my clients too, of the idea of like, I really even like what you said, Natalie, of like a lot of times it's just anxiety because even that is such a surprise for a lot of people and identifying that anxiety.
Mhm.
And what I really love to do too is to go deeper on what that anxiety
Yeah.
is.
Yeah.
Like, and you talked about some of those things of like, is it how comfortable you are with your body?
Mhm.
Is it that feeling of control and being out of control? For
Mhm.
some people it's the huge sense of responsibility or pressure that starts to weigh on them, like they're
Yeah.
responsible for their partner getting off
Yeah.
or they're not allowed to receive pleasure from their partner.
Yeah.
And for some people it can be really cathartic in session just to identify like how much weight and pressure they are putting on each sexual interaction, and that's the
Mhm.
cause of the anxiety.
Mhm.
And you know, when each sexual encounter
Mhm.
means like your relationship is succeeding or
Mhm.
failing, then it makes sense that that's going to really scare you, and two, you're
Yeah.
not going to want to put that to the test. You're not going to want to
Yeah.
have sex to see if your
Yeah.
relationship is failing or not.
Right. That's an excellent one. Sometimes I'll joke
Mhm.
with my guys. I'm joking, but I'm very serious. And so we'll talk about if the whole weight of the relationship is resting on your dick standing up or not standing up, I wouldn't show up for that either. Like
Right.
that's a lot of pressure. And so like I'm supposed to give this fabulous performance, and if I don't, my partner may be crying, and then we're in an argument, and then we're in a fight. Like that's a lot of pressure. And so give yourself grace. Let's talk about the pressure. Let's allow for failure in sexuality. How about that? Like it's
Mm.
okay to have a bad sexual
Mhm.
experience, and it doesn't mean the end of the relationship. So okay.
Yes.
All right, Taj, what are you hearing? What do you want to add to the conversation?
So, with this conversation, it got me thinking about the relationship between trauma and anxiety and
Hmm.
depression medication, and then how it relates to um, changes in your sex drive. Can
Mm.
I speak from personal? Because I'm still getting my feet wet with clients.
Okay, but this is live. We are live and being
Oh,
recorded.
I
So
understand. I
just
understand.
just
I
long
understand.
take care of yourself. Okay.
For sure. But I think it's helpful because I personally suffered PTSD
Mhm.
and was placed on antidepressants to treat it. And I definitely noticed a significant drop in my sex drive.
Mhm.
And that even brought about some anxiety because at the time I was in a fresh and new
Yeah.
relationship. And I'm just like, well, if I can't perform, he's not going to want to be with me. He's not going to
Mhm.
want to, stick around
Mhm.
through me working through all of this trauma. And so all of those thoughts, it made sex very, very difficult and debilitating, honestly. But I didn't want to risk um being taken off of the medication
Yeah.
because I noticed it helping with my
Yeah.
PTSD.
Yeah.
And so the solve for me, and which is why I wanted to bring this up, was to be overly intentional about
Mhm.
sex. So
Yeah.
we went the whole nine. Candles, um, Teddy Pendergrass on the iTunes. I mean, mood
Yeah.
lighting, incense burning. I put on something a little risque. I mean, we did the whole thing, but we had to like I said, be very, very intentional about it
Mm.
because spontaneous sex was out of the question. Um, it just wasn't happening for us. So
Yeah.
if I knew at the end of today this is what's going to happen, I was able to prepare myself. I was able to get everything that I needed to
Yeah.
be successful in that endeavor.
Yeah.
And it worked. And I wanted to offer that in case anyone is listening, and they've dealt with the same thing, on
Mhm.
any type of anxiety or depression medication, they felt their sex life drop. There are means to
Yeah.
kind of crank it back up. There are ways. It's so I just that was what I was thinking.
Wow. I'm
Mhm.
so glad you said that. And actually, Sharon, I know that you walk your clients through that. And so I think it was perfect for Taj to go. So now we can give it to Sharon because I've seen you and heard you talk about cases where you've talked to clients about, okay, how do we be intentional? Where can we get this started? Like, what's the little thing we can do? What's that one minor first step? And so talk, Sharon. Like, give the people your wisdom.
Oh, thanks. Let's see here. Well, I'm thinking, I said, well, hey, everybody said everything, but to think about what you just said about
Mhm.
what Taj just spoke about is people sort of not wanting to be that intentional, like Taj mentioned, because they feel
Mm.
like it's interrupting the natural process. So they'll
Yeah.
start saying, hey, I just want to be able to walk upstairs and rip our clothes off and make love. And then, they like, well, I don't know about this planet. I don't know about these candles. I don't know about this Teddy Pendergrass, but like she just said, it works. So she's like
Mhm.
proof that it works. So
Yeah.
understand at some point, it probably just became natural, right, Taj?
Mhm.
Mhm.
Like you
Mhm.
wasn't even thinking about it. It just
Yep.
started,
And
your
it
libido picked up and you were just in
Mhm.
yes.
kind of ready, probably around the same times every week.
And you know what? It helped us remain present. And I think that was the biggest like gem that
Mm.
my husband and I got from it, is that we were present because our senses were so overly worked. It was kind of it made the experience better because it was harder for us to drift away and think about
Yeah.
other things going on.
Yeah.
Because I mean, I drowned our senses in sensuality. I sure did. I sure did.
That's a good point. So I'm going to drop in right there. Sex should include all five of your senses.
Mhm.
Like it should be a totality experience of all of your
Mhm.
senses. So what are you seeing? What are you hearing? What are you smelling? What are you touching? What are you tasting? And so making sure you include all of that in your experiences. And the intentionality, I think, is so important. And also understanding that as we get older, as our schedules get busier, as we get kids, as life changes, spontaneity for much of anything kind of goes away.
Mhm.
When I'm
Yep.
20, I remember popping up and going to the mall, popping up and doing this. Oh, let's go on vacation this weekend. Like, let's leave now. And you can do all those things as you get older, as life changes, as you get more stresses, more responsibility that changes. But yeah, and we understand that. Like, now we understand that I can't decide on Friday night to go on a vacation Saturday morning, and
Mhm.
we accept that. But something happens with sex that I get now that now I got to schedule it. I can't do it spontaneously anymore. And something, I don't understand why we don't understand that as a culture, that sex kind of changes throughout the lifespan. Not
Uh-huh.
only does sex, but that your sexual desire will ebb and flow throughout the lifespan, ebb and flow with what's going on in your life. And so if you're taking some meds right now, that may be having your sex, your desire, your sexual desire on more of an ebb instead of a flow. And
Mhm.
understanding most of these things, like time, like this too shall pass, it'll pass. All right. So Mary Hannah, you were definitely shaking your head. Yes, yes, yes. All right. So what were the
Yes.
things that you were saying yes, yes, yes to?
Yes, I just was agreeing so much with what Sherian was saying about how, like, there is such a strong sentiment that couples don't want to plan. They don't
Mm-hmm.
want it to feel structured. And it's this idea of just exactly what Sherian was saying. It's like it should be like we're just bursting at the seams with desire. Like,
Mm-hmm.
and if we talk about it too loud, it'll just wisp away. Like all of the sexuality in the room will
Right.
disappear if we talk about it too clearly. And which I do feel like has to also do with like how we see sex portrayed in media, you know, like it's
That's what I
something
was
we're going to
thinking.
say here over
Yeah.
and over and over is like when you see like a healthy couple on TV, what's like one of the number one ways that we are shown that they are a healthy couple? If they just look at each other and they just know it's on and they're having sex and it's like, wow, that's a healthy couple, you know, like there are just so many of those messages
Sure.
that we receive that make people so afraid or have such certain ideas about how
Yeah.
sex should happen.
Yeah.
And it is one of those things where it's like, no, it's okay. It's okay to plan it because what's really the most important thing about sex and walking clients through what is it you really want out of sex, and then clients start to realize, oh, it's emotional intimacy, it's connection. Those are the times I had the best sex.
Yeah.
So planning is not going to get in the way of that.
Yeah. Yeah.
Mhm.
It is amazing to me still to this day how many clients will have a conversation about maybe what turns us on or what's kinky sex or what's the most exciting thing you ever did, but not a conversation about what makes good sex for you. Like,
Mhm.
what's a good sexual encounter for you? What are the components of just good, you know? Because I think we all tend to go toward the sensational. Like, so what's the craziest sex thing you've ever done? Or, what's the one thing you wouldn't do again? But every day, what's good for you? What makes it good for you every day with that? Um, I think another thing I wanted to say about anxiety is some anxieties can be so sneaky that
Mhm.
you wouldn't realize that this is anxiety. And it's affecting your sex life. So it could be as simple as I don't want to get pregnant again, or
Mhm.
I don't want us to be pregnant again. And so that's going to have you have low desire because I don't want to do the thing that would get us pregnant again. I wasn't ready for that last pregnancy. It really threw off our coupleship and the relationship, and I don't want us to do that again. And so people will shy away from that. What's some odd fears that people have come up that y'all have heard, like come out in the counseling sessions? Can you think of one, Mary Hannah, that's just been like, oh, I could see how you'd be scared of that.
Well, I definitely even will say, like, totally like the pregnancy thing, that's something I
Mm-hmm.
always like to check in with couples is like,
Mm-hmm.
what's your history of that? History of
Yeah.
miscarriages, like, and
Miscarriages is a big one. Mm-hmm.
right. And like, what kind of, like, are you trying right now? Are you on birth control right now? Because if you're not on birth control, but you're also like not trying, you
Mm-hmm.
are trying. Uh, so that's
Right.
always a really important thing to get into. I feel like a lot of anxieties that I see can sometimes
Mhm.
be gender based. It can sometimes be like, because I'm the woman or because I'm the man, I have to provide this sexually.
Mhm.
And that kind of anxiety can come into play. And it's something that like
Yeah.
they kind of like, as they say it out loud, they're like, huh, that doesn't really make sense in the actual context of my relationship. Cause then their partner
Mhm.
will be like, well, you don't have to do that for me at all. But it's
Mhm.
still this anxiety that they've kind of internalized from how they've seen couples growing up talk about sex.
Yeah. Oh, that's a big one. Okay, Sharon, can you think of any ones that you've seen that's just been like, I see that, and I do see how that could be a fear, an anxiety,
But I
scared.
don't
Yeah.
know if it's be odd. I'm sure it's probably not odd, but see, even knowing that your partner is suffering from depression or any type of physical sickness
Mhm.
or anxiety can sometimes interrupt uh the flow of desire.
Mhm.
And I would say sickness is number one on my list. Sickness and probably major depression. Seems like it really calls clients to be able to not, understand where they fit in with their other partner when it comes to sex and how to support. So it's like I see you being very, very sick, but I don't really know how to jump into bed with you. Would this be invalidating? Would you feel like I'm taking advantage of you? in your time of weakness. They just really don't know what to do. And maybe they lose some attraction towards their partner during sickness, maybe not like, I don't think that you're not handsome or pretty, but maybe just in the sense that I'm not sure about having sex with you right now. How do I feel about this? I don't really want to know this. Sometimes sickness can bring about smells to breath or body, and the other partner may not know how to communicate. Hey, you've been going through this thing or taking this type of medication, and it's causing some smells that's undesirable. And they will absolutely take a long time in therapy to communicate that, right? But then once it's communicated, they have things to work on, and then they'll find that sometimes the partner don't mind accommodating that by maybe getting breath mints or maybe extra showering or using scented based soaps or lotions, anything that would be helpful. But that would probably be like the only thing that I could think of that would be a reason for not being intimate. My way of thinking, I don't really think that anybody's reason is odd. I just always think it's great insight. And I'm happy to know that this thing exists, right? So I don't really never view it as a odd. It's almost like, wow, okay, that's good insight, so everybody had their different reasons. I was kind of rambling, Natalie, waiting on you to get back.
Thank you so much. I'm so sorry. I'm so sorry.
I was like, how can I keep this show going?
So the wonderful thing about working from home is that people will randomly knock on your door. And so that is what happened. All right. So, okay. Let's pivot a little bit since I'm back now and talk about people who are on medications that are affecting their sex life. What would you want them to know and what would you want them to start doing? And so I'm going to start with you, Jessica Addison. And so let's say if I'm on a medication and it's affecting me some type of way where I can't have sex. I don't want to have sex.
But I think what I said at first, you always have to talk to your physician and you have to look at all the side effects. Because a lot of times when people get medication, they read all those side effects and they just skim through it and they don't think it's going to affect them. But you have to really look at every single one and see what actions have I been doing lately that kind of fit into that category. And then with that, have another consultation with your doctor and let them know, hey, I am having this side effect. What can I do? Or is there an alternative medication that still fits the same purpose, but doesn't give me this side effect that's affecting my relationship?
Yeah, that's really, really good. All right. Mary Hannah, what would you ask and add?
Yeah. Oh, even to add on to what Jessica is saying is talking to either maybe maybe your therapist knows an NP that you can talk to this about, or you can talk to your physician. But sometimes if you're on different medications, they can interact together in a certain way that maybe your doctor isn't necessarily aware of. Because when you talk about pharmacies used to be able to really prioritize how do these medications interact and how can I make sure that the patient knows about it. But now with really commercial pharmacies, it's much more about how many can we crank out. And so a lot of pharmacists don't have that time to let their patients know how medications may interact with each other. So that's also another thing to think about is how those interactions may happen. But even to I think just really getting used to the idea of pushing through and making it a priority and an intentionality is super important. And you have to sort of be on board with that of making that time and that effort.
Definitely so. All right, Sharon, what would you add?
First, I would say admit that it might be the medication that's giving you a side effect, right?
Yeah.
And sometimes that takes about 2 sessions to just get the client to realize that it definitely could be your medication.
It could.
Have you talked to your physician and asked them, is this a side effect? I did some research and it's a side effect. Well, I'm
Mhm.
not sure because I've been
Mhm.
taking this medicine and it's never been a problem before. And then, it's like, well, maybe it's a
Mhm.
problem now. You just been
Mhm.
on it a year. You just been on
Mhm.
it. Maybe it's
Mhm.
some other changes that's happened. So
Yep.
first get it because and letting the client know that doesn't mean that you would have to choose one or the other.
Yeah.
But just understand how to work with you from that point.
Mhm. Mhm.
So if it is medication, it just still goes all back to, my way of thinking is I always ask my clients, are you ever horny?
Just that
Do you
simple.
ever just sit down, even if it just lasts for
Right.
5 minutes?
Mhm.
Does it
Mhm.
ever occur for you?
Mhm.
And most of it, I'm gonna say about 98% of the time, somebody's gonna be like, yeah, but I be in the car driving home from work. And then by the time wait. So we just want to make sure you got the ability to feel some
Right.
type of desire sometime. So
Yeah.
since the ability is there, then we
Mhm.
can definitely work on how to bring it more present. Because I believe in a 90-day span, really in a 30-day span, you're going to have to be horny one of them days.
Yeah.
So
Mhm.
paying attention.
One of them
Right.
Why were you
days.
even horny on your way home from work anyway? What happened?
Yeah. 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 That's such a
I
good
love
one. That's
that.
such a good one. Okay.
I love
All
that.
right. Taj, what's coming up for you?
I would say, I'm co-signing everything everyone else has said, but I would say talking to your partner. And I know it
Mm.
seems like something so simple, but like there is a social stigma around being on any type of psych meds. And
Yeah.
then there's a social stigma around any sort of um, sexual issue. Like,
Mhm.
and I can imagine, someone keeping this from their partner
Yes.
because it's embarrassing. It
Mhm.
just is.
Mhm.
And so I would encourage anyone who is experiencing what we're describing here to have that difficult
Yeah.
conversation with your partner. Let them know, exactly what's going on, and that gives your partner an opportunity to show up for you, which would then, increase the amount of emotional intimacy that you have with your
Yeah.
partner, which is ultimately what we all want from sex, right? I mean,
Yeah.
orgasm and emotional intimacy, right? Um, or let's say the opposite happens, right? Your partner shows that they are not supportive.
Mhm.
Then this is the opportunity to reevaluate your relationship. I feel like because if you have a partner who
Yeah.
reacts negatively and makes you feel worse about
Yeah.
seeking treatment
Mhm.
for, a condition that you are out of control of, then yeah, that's a whole nother conversation. But
Yeah.
at least you would be privy to that, you know.
Yeah.
When people show you themselves the first time, you better pay attention. And so I just think you should talk to your partner,
Yeah.
honestly. Just talk to them. Tell them what's going on. Tell her what's
I'm
going on.
I'm gonna wrap up and say, talk to us.
Oh yeah.
And so, so whether you are having anxiety about having sex, something that has to do with sex being painful, no matter what, premature ED, it doesn't matter. Have a conversation with us. Call us. We are here to help you and support you. If you have a reaction to a medication and now it has affected your sex life, or you don't know, but something's going on, talk to us. Like, there is so much value to sitting down with a person who does not know you personally and
Mhm.
going through your life to help you figure out what happened, what's missing, what's changed, what's different, you know? And so, like, just the simplest things of, well, have you thought about this? Well, no, I never have. So, and even I've had that experience in therapy of like, no, I didn't think about it that way. And so, because what can happen is we get so caught up in our insecurities or our pain or just our viewpoint that it's hard for us to access different information, to see it from a different perspective, to think about trying something different. Um, like somebody can just come in and say, but if you use a chair instead of a bed, how would that change it? Oh, I never thought about sex in the chair. But would it change it? Well, yeah, it would. I wouldn't have that problem that I was having. There you go. And so there are definitely, we have cases that are longer cases, but I've had some cases that were shorter cases just because it was about us giving the client simple suggestions and helping them think about it differently. It wasn't even that complicated. It's let's do this. It's how about now we be intentional. It's creating a paradigm shift so now that they can access the ability to do things differently where they couldn't before. So I hate those stories where like the clients and come in and they've been struggling with something 4 years, 6 years, 10 years, 20 years. And it's just like, man, because we're going to get this fixed in about 6 months,
Mhm.
you know, a year if we have to take time off for like the holidays or something. But we're
Mhm.
going to get this handled and fixed. And it's just about changes and paradigm shifts. So we're here to help you um, with a myriad of issues. And if we never mention your issue, doesn't mean that we're not able to help you with that. We just hadn't gotten to it yet in this format. So we're here. In between all of us, there's years of experiences. So one of us should be able to figure it out for you. And if we can't, we'll go figure it out. We'll go get the information we need to help you get what you need. So thank you, ladies, for your time. I appreciate
Always.
everything that y'all did today and all of the conversations, and I'll see y'all next time. All
Bye.
right, bye.
Bye.
Bye.